Well, my name's Dr. William Berlin. I'm an internal medicine doctor and have been practicing here in Albuquerque since 1991. With so many people in the state of New Mexico being uninsured, the increase in cost is obvious. It leads people to shop around if they can, try to find a cheaper deal, but a lot of people just have to struggle. You know, and we know nationally, there have been good studies nationally that show that people are losing all of their savings. They're going bankrupt, and that the biggest driver of that in the last 2 years, 3 years perhaps, has been what they call medical bankruptcy. And I see it. I see it in my patients. And as those costs go up and up, people also do without things. They've got their discretionary income is decreasing, and sometimes they will want to split pills, and they'll want to miss doses just to be able to make things stretch to that next payday. And that's not safe and it's not healthy. So I have to ask people now, do you have the money to buy your medications? Are you able to afford your food? Did you miss Dr. Smith's visit because you couldn't afford the copay? When people get so sick that they have no other recourse and they're in the emergency room using it for something that could have been headed off a lot earlier by simple primary care services, they put an inordinate strain on the delivery system in the emergency room, in the hospitals, on those providers that are working in those facilities. And the economic drain gets passed along. The hospital eats the cost of the emergency room visit that's not reimbursed. The hospital passes that along in the myriad of procedures and supplies and the different fees they charge to the paying customers. The paying customers' insurance raises its premium to make up the difference. So it gets passed along indirectly and directly to all the rest of us who are paying customers. And if we don't sustain the workforce and keep the working people of the United States healthy, more and more of them fall into sickness, diabetes, obesity, hypertension, mental illness. All of the problems that we deal with now are going to be compounded.